Do black and white people experience pain differently? Are they treated differently? And what is opioid use disorder? This study looked at the subjective experience of people with persistent pain and aimed to identify similarities and differences among non-Hispanic black and white patients in Texas, United States. Although there were many similarities between the two groups concerning their pain experiences, black patients reported significantly lower perceived control over pain, greater reliance on passive coping strategies, stronger belief that others should be more considerate and caring of their pain experience, higher levels of depression, and higher levels of disability even after controlling for pain severity. In the past 4 decades, the nature of the opioid epidemic has shifted from heroin to physician-prescribed opioids. However, due to greater regulations on MDs prescribing them, it's now once again shifting towards heroin. The prevalent use of opioids to manage chronic pain has led to an opioid epidemic due to the dramatic rise in opioid addiction and overdoses. The systemic racism that exists in the healthcare system is that the data shows that in USA, black individuals suffering with pain were significantly less likely to be prescribed opioids or any other pain treatment options by an MD when compared to a white individual with identical pain history. African American older adults, particularly those who live in economically deprived areas, are less likely to receive pain and psychotropic medications compared to whites. Why are doctors more cautious in prescribing opioids to some than others? Do doctors consciously or subconsciously assume that a black person is more likely to abuse the drug than a white person? Or do they assume that a black person will not be able to afford the medications, so they don't prescribe it? Although this racial discrimination has resulted in significantly fewer black people being prescribed opioids, they still suffer from opioid addiction. Much of the social and political attention on the opioid epidemic has focused on the rise in overdose deaths among white, middle-class population, while opioid addiction in black communities has largely been unrecognized. Current data shows that opioid use is higher for whites than they are for blacks. However, over the last decade, the rates of increase in opioid deaths have been rising more steeply among blacks than whites. Sadly, the rate of opioid overdose deaths among blacks already exceeds that of whites in several states. The lack of discussion of black overdose deaths in the national opioid discourse further marginalizes black people and is highly consistent with a history of framing the addictions of people of color as deserving of criminal punishment rather than worthy of medical treatment. In simple terms, opioid addiction among the white population is addressed as a health crisis requiring medical care, while opioid addiction among the black population is treated as criminal behavior requiring punishment. Here is an unfortunate quote regarding illegal drug users. When the perception of the user population is primarily of color, then the response is to demonize and punish. When it's white, then we search for answers. In summary, due to the prevalence of racial inequalities, targeted mental health programs to benefit black and poor communities are required to address the opioid crisis. Important notes. Sadly, compared to white people, black people are less likely to have their reports of pain believed and to be offered pain management strategies. However, they're not alone. The same discrimination has been found to be present for Indigenous and First Nations people, women, and people of lower socioeconomic classes. The current medical system tends to offer white males more options for care than most other identifiable groups. There is no doubt that opioid addiction has the potential to destroy lives and families, but we must also be cautious not to vilify all opioid use. Some individuals living with chronic pain depend on prescription opioids to simply move, function, and be less dependent on family members in order to have a better quality of life. Opioid crisis is not just about pain. This eye-opening article by Dave Walton suggests that the current opioid crisis should not simply be linked to a pain crisis, but to a health condition known as opioid use disorder. Greater incidence of opioid use disorder has been linked to homelessness, poverty, and those with childhood or intergenerational traumas. It's fascinating that in the USA, lower prevalence of OUD was found in the states with greater access to mental health care. To reduce the impact of OUD, perhaps Canada must invest in greater mental health programs. I fear this focus on pain and overdose is a focus merely on the symptoms of a broader crisis. A crisis of undermanaged mental illness and unresolved emotional trauma throughout Canada. We need to think about a world after the opioid crisis has passed, to ensure that mental health services are available and that those who require opioids for intolerable pain have options. You may access his full article at the link below. What's your experience on the difference between how Black versus white patients are treated in the Canadian healthcare system or rehab in Canada? What's your opinion on the decriminalization of all currently illegal drugs? What's your opinion on transferring the millions of dollars spent on policing, prosecution, and imprisonment to social assistance and mental health? Access all videos on the video library on aptei.ca. Thank you again for subscribing to the APTEI Reports.